Welcome back, all of you, to Government Nursing Officer exam preparation for various central government exams like RRB, ESIC, AIMS, JIPMER, UPSC, etc. This is the mock test explanation series, part 48. Your active participation is very important to maintain more videos in this channel in this series. Please like, comment, share, and subscribe for more videos for central government nursing officer exam preparations. We have already uploaded so many videos in nurses exam preparation for central government exams. It includes 100 mock tests, exam preparation topic videos, memory series with memory tricks, and mock test explanation videos including in this series. And much more videos are on the way and on preparation based on your feedback and active participation. Let us go to the session now. Let us go to the first question. First question, a procedure done as a treatment of chronic sinusitis is option A, Caldwell-Luke procedure, option B, Duhamel procedure, option C, Swenson's procedure, and option D, Fothergill procedure. The right answer here is option A, Caldwell-Luke procedure, which is for chronic sinusitis. You can see the diagram here. Other two procedures, Duhamel procedure and Swenson procedure, is done for Hirschsprung disease. Then Fothergill procedure is for uterine prolapse. Next question, metabolic emergency frequently found in small cell lung cancer is option A, SIADH, option B, hypercalcemia, option D, metabolic encephalopathy, and option D, tumor lysis syndrome. Let us see the right answer. If you need additional time, please pause the screen because as it is mock test explanation series, we are fastly covering all the topics. The right answer here is option D, tumor lysis syndrome. The most recognized metabolic emergency in small cell lung cancer is tumor lysis syndrome, which is caused by the rapid breakdown of tumor cells. Next question, abnormal low-lying or drooping of upper eyelid is option A, stye, option B, strabismus, option C, presbyopia, and option D, ptosis. The right answer here is option D, ptosis. You can see the diagram here. Abnormal low-lying or drooping of this eyelid. You can see the upper eyelid, which is ptosis. And other options like option A, stye, we can see a lump on the eyelid. You can see over the eyelid, you can see this red colored lump. Then strabismus, you can see different types here in this figure. It is the the eyes are not pointing towards one focus. You can see both the eyes are in different directions. So according to the direction, you can just classify this like estropia, exotropia, hypertropia according to the direction. You can see the different subtypes of strabismus as well. Then presbyopia, it is the focal point abnormality. The focal point is behind the actual point. You can see here, and normal vision, you can see the focal point exactly on the retina. It is just behind the retina. That is presbyopia. Let us go to the next question. A patient complains of drawing sensation on one side of the face followed by paralysis of all ipsilateral muscles is admitted to your unit. Which among the following is the most possible diagnosis? Option A, tic douloureuse, option B, Bell's palsy, option C, Erb's palsy, and option D, glossopharyngeal neuralgia. The right answer here is option B, Bell's palsy. Option A, tic douloureuse is trigeminal neuralgia. The other name for this disease is trigeminal neuralgia, and Bell's palsy is the condition where the drawing sensation of one side of the face followed by the paralysis. So here it is happened due to the damage to the facial nerve, Bell's palsy. You can see the figure here. the deviated mouth, you can see this affected side. This is the classic signs of Bell's palsy. And Erb's palsy is due to the birth injury to the brachial plexus. And glossopharyngeal neuralgia is the painful disorder of the ninth cranial nerve. Next question, the test that assess collateral blood flow to the hands in radial and ulnar arteries is option A, Barlow test, option B, Ortholani test, option C, Allen test, and option D, Coombs test. Let us see the right answer. The right answer here is option C, Allen's test. You can see the figure here. This is Allen's test, which assesses the collateral blood flow to the hands, radial and ulnar arteries. Barlow test and Ortholani test is the test used for hip instability in newborns. You can see a memory tip which is already mentioned in previous videos. Just a reminder, when you go to bar, you will lose the hip stability, because when you drink so much, you will lose your stability of the hip, you can say like that. So this is the memory tip for Barlow test for hip instability. Then Coombs test is for antiglobulin test. So Coombs test is to detect the antiglobulins, that is also known as antiglobulin test. Next question, false fixed belief, which can be explained as arising from other abnormal experiences, is called option A, unspecified delusion, option B, primary delusion, option C, autochthonous delusion, and option D is secondary delusion. The right answer here is option D, secondary delusions. We can see the different types here. Unspecified delusion is which is not specific to any particular point. Here, autochthonous delusion is a delusion of fixed belief that arises suddenly and without any apparent cause. So this is without any real cause, that is autochthonous delusion. Then primary and secondary, you can see the difference here. Primary delusions arise spontaneously and are not secondary to any other mental or physical condition. But secondary delusions develop as a result of another underlying condition. Here, the question is, false fixed belief can be explained as arising from other abnormal experiences, secondary delusion. Next question, Kala Azar or black fever is the disease caused by option A, rat flea, option B, sandfly, option C, lice, and option D, mites. The right answer here is option B, sandfly. Kala Azar or black fever is caused by the sandfly. Rat flea will cause many diseases including plague. Lice will cause diseases like epidemic typhus, and mites will cause diseases like scrub typhus. Please remember this also for your exams with memory tips and color coding, etc. Next question, a person persistently wear clothes of the opposite sex actually or in fantasy or for sexual arousal. This disorder is a dual role transvestism, option B, primary transsexualism, option C, secondary transsexualism, and option D, fetishistic transvestism. The right answer is option D, fetishistic transvestism. Here, dual role transvestism is the type of transvestism where no sexual motive is there, but in fetishistic transvestism or transvestic fetishism, it is a paraphilia characterized by recurrent intense sexual fantasies, urges, or behavior involving wearing clothes traditionally associated with the opposite sex. So here sexual motive is involved, and the other one, dual role transvestism, it is not involved. And transsexualism, primary is in early stage and secondary transsexualism is in the late ages of life. Next question, which of the following is pituitary dwarfism? Option A, Froehlich syndrome, option D, Lorelei syndrome, option C, Sheehan syndrome, and option D, Simon syndrome. The right answer here is Option B, Laurent-Levy syndrome. It is pituitary dwarfism. Laurent-Levy syndrome is a form of pituitary dwarfism characterized by proportional dwarfism that appears in childhood. The other options, option A, Froehlich syndrome is adipocogenital dystrophy. Sheehan syndrome is the postpartum pituitary necrosis, and Simon syndrome is pituitary cachexia or hypopituitarism. Next question, immune reaction occurring in blood transfusion reaction is a type of option A, microangiopathic reaction, option B, autoimmune reaction, option C, macroangiopathic reaction, and option D, isoimmune reaction. The right answer here is option D, isoimmune reaction, which is against the antigens. Blood is an antigen, and the kind of reaction which happens against an antigen is isoimmune reaction. Here, autoimmune reaction is against own cells. There is no external agent or antigen is involved. It is against the own cell. That is autoimmune reaction. Microangiopathic reaction is happening in small blood vessels. It is micro is small, and macroangiopathic reaction is happening in large blood vessels. Macro is large. Next question. The lesion contains a central red spot and reddish extension which radiate outwards like a web seen in conditions like cirrhosis is option A, cherry angioma, option B, spider angioma, option C, venous star, and option D, angiokeratoma. The right answer here is option B, spider angioma. You can see the diagram here. The lesion contains central red spot and reddish extensions which radiate towards outer area like a web seen in conditions like cirrhosis. You can see it is radiating outwards. Cherry angioma is just like a small cherry-like angioma. You can see it here, bright red. And angiokeratoma is just keratinized. You can see the keratinized blackish color of angioma. Next question. A mental health nurse adopt role play or sociodrama for facilitating insight into client's behavior. The most appropriate principle used is option A, avoid unnecessary increase in the client's anxiety. Option B, use self-understanding as a therapeutic tool. Option C, change the patient's behavior through emotional experience, not by rational interpretation. And option D, objective observation is used to understand client's behavior. The right answer is change the patient's behavior through emotional experience, not by rational interpretation. Next question, Monday fever is option A, byssinosis, option B, bagasosis, option C, tuberculosis, and option D, farmer's lap. The right answer here is option A, byssinosis. Byssinosis is otherwise known as Monday fever, which is caused by the cotton dust, and bagasosis is caused by the sugarcane dust. Tuberculosis is caused by the tobacco, and farmer's lung is caused by the hay or grain dust. Next question. A non-alcoholic client admitted to de-addiction center has been started on disulfiram. The usual dose of disulfiram is option A, 250 mg to 500 mg, option B, 750 mg to 1000 mg, option C, 50 mg to 100 mg, and option D, 100 mg to 200 mg. The right answer here is option A, 250 mg to 500 mg. Disulfiram standard dose is 250 mg up to 500 mg. The next question, the disease in which slapped cheek appearance present is option A, mumps, option B, measles, option C, fifth disease, and option D, sixth disease. The right answer here is option C, fifth disease. Here you can see the reddish color over the cheek which will give the slapped cheek appearance in fifth disease. Next question. Pterygium can be defined as option A, white deposit found on the cornea, option B, fleshy triangular shaped growth on the conjunctiva, Option C, cyst found on the conjunctiva, and option D, scarring of the cornea. The right answer here is option B, fleshy triangular shaped growth on the conjunctiva. A pterygium, also known as surface eye, is a non-cancerous raised fleshy growth that originates on the conjunctiva and can extend onto the cornea. Next question. H5N1 is option A, influenza, option B, bird flu, option C, SARS, and option D, swine flu. Right answer here is option B, bird flu. Bird flu is H5N1. Influenza is H3N2 or H1N1. SARS is CoV2, or it can be from COVID virus like COVID-19, and swine flu is H1N1. Next question. The nurse renders parental skill training during antenatal and postnatal visit. This approach is option A, secondary prevention, option B, primary prevention, option C, tertiary prevention, and option D, primordial prevention. The right answer here is primary prevention. The nurse rendering parental skill training during antenatal and postnatal visit is an example of primary prevention method. Primary, secondary, tertiary, and primordial prevention methods, I have explained it many times in many of the previous exam preparation videos. Please go through detailedly with the examples from the previous videos. To minimize the time, we will go to the next question. Pinpoint hemorrhage into skin caused red spots in skin is termed as option A, ecchymosis, option B, erythema, option C, petechia, and option D, pus. Right answer here is option C, petechia. Petechia, you can see, it is the pinpoint hemorrhage into skin causes red spots in skin. Next question. Post myocardial infarction patient if complaints of chest pain increasing with deep breath, which nursing action is appropriate? Option A, obtain vital signs and auscultate for pericardial friction drug. Option B, obtain 12 ECG and inform physician immediately. Option C, give high flow oxygen, and option D, give SOS analgesic and observe for 30 minutes. The right answer here is option A, obtain vital signs and auscultate for pericardial friction drug. Next question. Other name of pulmonary TB is option A, Pott's disease, option B, Packett's disease, option C, Koch disease, and option D, Still's disease. The right answer here is option C, Koch disease. Koch disease is the other name for pulmonary TB. Pott's disease is TB of spine, and Packett's disease is osteitis deformans. A child presents with low par accuracy in the use of speech sound. The speech sounds are omitted or substituted. This disorder is option A, dyslexia, option B, dysorthographia, option C, dyslalia, and option D, dyspraxia. The right answer here is option C, dyslalia. Dyslalia is the inability to articulate comprehensible speech. So this is where the low par accuracy in the use of speech sound happens due to the inability to articulate comprehensible speech. Dyslexia is a learning disability in writing and reading. Then dysorthographia, difficulty in correct writing with correct spelling. This is dysorthographia. Dyspraxia is the developmental coordination disease, or DCD. Next question. The condition in which there is loss of the ability to identify objects or people is option A, abjulia, option B, aphemia, option C, agnosia, and option D, amnesia. The right answer here is option C, agnosia. Agnosia is the loss of the ability to identify objects or people. Abulia is the lack of initiative. It is just like avolition. Aphemia is the lack of motor function of speech production. Amnesia is the loss of memory. Next question. A nurse, while being with the client with violent behavior, should not. Option A, provide high calorie food. Option B, argue with the patient. Option C, provide a consistent structured environment. And option D, give simple direct instructions. Right answer here is option B, argue with the client. Here, the negative word should not. So, what the nurse supposed to be done is the wrong options here, and what the nurse should not done should be the right answer here. So, provide high calorie food, provide a consistent structured environment. Yes, structured environment is essential for the client for controlling his violent behavior. Then give simple direct instructions will help to understand. Complicated instructions will trigger him. So this is also correct option. Here argue with the client is not the correct behavior, because arguing will not escalate, will not solve the problem. It will escalate the problem and it will further deteriorate his condition. So argue with the client, with a violent client, should not be done by a nurse. Next question, which is the last question of this portion. The test that is performed to evaluate vitamin B12 absorption or cyanocobalamin absorption is option A, Schilling's test, option B, Stick's test, option C, Vidal test, and option D, Roberg test. Let us go to the right answer. The right answer here is option A, Schilling's test. Schilling test is for the vitamin B12 absorption. Stick's test is for diphtheria. Vidal test is for typhoid, and Roberg test is for assessing the sense of balance. So we are winding up this session with this question. Thank you all for watching this video. Please like, share and subscribe for more exam preparation videos. Thank you so much.